no imported case was reported yesterday in Hubei. The cities outside of Wuhan have maintained no new cases reported for 40 consecutive days. As of April 13, 2020, there still remained 219 patients in hospital, including 32 in severe condition and 37 in critical condition. As of yesterday, the total fatal cases stood at 3,221. The number for yesterday was 0. As of April 13th, the cumulative discharged patients reached 64,336, and the number for yesterday was 25, all in Wuhan. As of midnight of April 13th, the newly increased asymptomatic cases were 22, none of which developed to the confirmed cases yesterday. 32 asymptomatic patients have been discharged from quarantine, and 610 are still under medical observations. Thank you. Now I would like to give the floor to Mr. Wang Wei regarding the medical treatment in Tongji Hospital. Friends from the media, good afternoon. Since the outbreak of the novel coronavirus, the Tongji Hospital of Huazhong University of Science and Technology has shouldered the responsibility to treat people. We always stay true to our aspiration, and under the strong leadership of the municipal government, we all involved in the fight against COVID-19. Now I would like to give you a brief introduction about the medical progress and the cure and treatment of patients. In mid-January, we have expanded the room from the 110 square meters to 5,000 square meters of our fever clinic, and also issued the technical guidance. For the first day, we have 400 doctors and department members at the outpatient service, and we also expanded and renovate the 2 wings of our buildings specifically for the critical and severe conditions. Make sure that all patients need to be hospitalized or hospitalized. For makeshift hospital, just in one day, we have established all the information system and started to receive the mild symptom patients. So far, 4 medical teams with 5,200 medics from across the country stationed in the Tongji Hospital 2 wing buildings, from the Department of the Respiratory Disease, the Critical Care Department, and the ICUs, and we also established the meetings on the daily basis, and also we have unified the treatment as well as the quality control team, and we also have different teams in incubation, the heart, and in total 8 specific teams to treat our patients. And we also utilize the both Chinese and Western medicines, and we also work with the Beijing Union Hospital as well as the Sino-Japan Friendship Hospital to introduce the technical guidance for all the medics, and we also pull all the resources, the medics as well as experts and resources to treat the patients in order to improve the cure rate and lower the mortality rate. During the whole course, the medical personnel in Tongji Hospital, after training, we all in this fight, no one withdraw or with a second thought. And some of our medical people, actually, they were in the holidays with their families, but they soon back to the hospital and involved in the fight. And we also established a temporary party committee. We should let the party members take the leading role, and also should be a good example to lead others. And we also deliver our commitment. As of April 12th, we have received 40,500 patients, and the 89,000 people received the service online, and also have around 800 people actually received the online service from overseas. So far, we have received 1,900 patients in the Guanggu Hospital, and the makeshift hospital also cured the 992 patients. 11 people got rid of ECMO, 37 got rid of the invasive intubation, 139 people with the convalescent plasma therapy, and 94 to 97% of patients received the TCM treatment. 238 occupations have been done, and the 146 lying-in patients were received. Right now, we still have 90 patients in hospital. 2/3 the severe or critical patients, and 69 actually have been cured and discharged. We will continue our responsibility and stay firm in our position in order to give the precise and scientific-based treatment to our patients and respect all the lives. Thank you very much. Now give the floor to Mr. Hu Yu regarding the work in Union Hospital in Wuhan. Friends from the media, good afternoon. In accordance with a decision made by General Secretary Xi Jinping and the CPC Central Committee, leveraging the strength of a national expert team, we have worked in different sectors that covering the whole process of treating patients from the beginning to the recovery stage. We work with 6,000 medics from the country to fight in 3 designated hospitals and 2 makeshift hospitals. 23,000 patients have been hospitalized, 5,200 patients in designated hospital. And first, we do everything to identify the confirmed cases. By the end of last year, we opened the fever clinics around the clock. So the doctor from the respiratory disease, infectious disease, and critical care medicine, he conducted 24-hour online case discussion. And later on, we also expand our space of the fever clinic to 5,000 square meters, which was 5 times larger. In order to avoid the cross-infection, we also had the online service available. The peak number is 12,000 per day. In total, we have provided service to 100,000 people online. Under the support of the municipal government, the people from the pathogenicity and also from the laboratory. And right now, the capability of testing is 27,000, and we have accumulated 600,000 tested in order to create a sound base for the treatment. And we have intensified our efforts to take patients in the hospital in order to cut off the transmission. We have overcome all the difficulties in order to enlarge the ward space. And we also renovate 2 hospital college plus our base. We have around 1,886 beds capability and also 2,226 beds in makeshift hospitals in order to take all patients in hospital. So we had the first makeshift hospital, the tumor hospital also create a new record, taking the patients of 400 per day. And we have tried everything to improve the cure rate. The tumor campus and the western campus are the old designated hospital, especially in the western campus. 87% of the hospitalized patients actually were the critically ill patients. We try everything to save their lives. First, we intensify the training to our medics in order to implement the treatment plan issued by National Health Commission, and we also compiled the technical plan and also rolled out nationwide. And we have also establishment the early warning system in order to prevent the patients to developing to the severe stage. And we also have the team to conduct the tracheal intubation as well as ECMO, and also provide the personalized treatment plan to each patient. We also have the a clinical study regarding the vaccines and also the convalescent plasma therapy. And we also over 90% the patients received the treatment of a TCM. Right now, the cure rate reached a 92.3%. The senior with age 80 and above years old, their cure rate 87.8%. And we also have the three patients over 90 years old, all cured and discharged from the hospital. And we also have the work regarding the tracing and interventing service available online as well as for the recovery stage. We also work with the third party to conduct the psychological counseling to the medics, and also provide these as a sound foundation as well as reference for the other institution. Right now, we have seen a good progress in Wuhan, but that's also a severe condition right now worldwide. So we also provide a telemedical sharing platform with the medical around the world. And so far, we have finished 10 operations and also conduct the 1,600 outpatient surveys. Right now, we already restored the normal medical order, and we only have one campus, which is the Western campus for the designated hospital for COVID-19. And we also had an online conference with General Secretary Xi, and saying that we should leverage our strengths to treat our patients, and we should also to carry forward our fine tradition that have been accumulated over the past 154 years in order to pay our contribution representing Union Hospital. Now the floor is open. Please identify your media affiliation before raising questions. Thank you. With Economic Daily. On March 10th, the central leading team regarding the disease prevention and control also issued a document regarding that a further promotion of the good practice in Tongji Hospital. Would you please talk more in this regard? Thank you for your question. Regarding the treatment of the severe and critical patients, always the top of our agenda, we have summed up the experience in this regard and also shared that with the 40 medical teams. We have received the tangible, fruitful results. First, we have established a model of treatment by taking more proactive measures, because we found that a lot of people are patients with multiple organ failure or the underlying disease. Actually, we found from the dice cases that the patient actually suffered not only the lung harm but also the multi-organ impairment. So before, we only had the doctors from Department of Respiratory Disease, and later on, you can see we have a team for the incubation, the TCM, respiratory, heart, kidney, lung, liver, and total 8 specific teams. So they were on call 24/7 and to provide the help to the different wards. that also help us to take more proactive measures to further lower the mortality rate and improve the cure rate. On top of that, we also worked with the other teams around China to establish a different team regarding nosocomial infectious disease, as well as the medical affairs office, to streamline our working process and also provide precise treatment to all the patients. And we have summed up the experience in swift manner and issued all these experience to the medical teams. So far, we have issued 37 guidance, especially under the guidance of a National Health Commission, with the previous effective measures and therapies, working with the Beijing Union Hospital, the Beijing First, Third Hospital, Beijing Renmin Hospital, and the Sino-Japan Friendship Hospital. We issued the management, a plan, as well as a transfer plan, a medical quality assessment plan, and also a process plan. And we also have a specification plan as well. And we also have conducted a high-level operations, and we also conducted different operations for the COVID-19 patients. Make sure that the patients receive the operation and treatment and lower the mortality rate. And we also use the TCM medicine, and we also had the cross-discipline, as well as the consultation with TCM experts. And more than 90% of patients were treated with TCM. Actually, you can see we have a lot of the available experience gained during the whole course. With China Daily, we would like to know what kind of the measures have you taken in bringing back normal medical service in Union Hospital? In fighting COVID-19, we also focus on providing medical service to other patients. Even in the most critical stage, we also opened our emergency service to the patients. Since February 17, we provide the service to the specific group, especially the seniors, the maternal women and children, and also people need to get the hemodialysis service and tumor treatment. And starting from March, we started to bring back a normal medical service, and we also bring more service back in April, with our key focus shifting back to the normal order in the hospital. So at the very beginning, we started to open the outpatient service, and from April 8th, the all outpatient service were all back to the normal order. Regarding the personal arrangement, with the decreasing number of hospitalized COVID-19 patients, the frontline medics, after 2 weeks quarantine, they should go through a strict body checking, and after they received a pass, they can get back to the normal position. So far, 7,000 medics already finished the whole process and back to their position. And the second, we have rolled out 3 measures. So in the outpatient service, we have a quite complicated screening process for the PCR testing, the epidemiological investigation, registration, CT scan, and body temperature monitoring. And once we found the patients need to be hospitalized, and we will keep them in the hospital ward so that one person in one room with one specific team. And we also have a buffer ward. And we also conduct a strict disinfectant process. So in order to provide a better service, we also need to provide a safe environment for all the people in the hospitals. And we also be bold to innovate new ways of conducting medical service. So we have encourage our patients to book appointment online through our apps or official website in order to avoid a big public gathering. Right now, all the outpatient service already back to order. The 148 departments provided service. And so far, we have seen more than 4,000 outpatients receive a service. In April, right now, we have 550 operations have been done, and yesterday the number was 55. Tai Kungbao from Hong Kong. Union Hospital as a designated hospital, especially for the critical and severe condition patients. What kind of measures have you taken to treat them? Thank you for your question. As one of the designated hospitals to the critical ill patients, so far we have hospitalized more than 1,000 patients. Right now we still have 46 in the hospital, but the majority of them show the negative to the virus, but they still suffering from underlying disease. 5 were on ECMO, 21 were on the trachea intubated, and one of the patients is in the 91 years old. The majority of the patients actually are senior with multiple underlying diseases. And we also have the team designated for the trachea intubation, the kidney protecting team, and we also have the experts from different departments as needed. And for the intubation or the respiratory tract management, and we also have the team work with the anesthesiology department to establish a specific team. And we also have a team led by myself to clean up the trays of the patients, so make sure that the our patients have the unimpeded respiratory tract that are also conducive to see a good improvement in their lungs and also improve the cure rate. And we also established a system of early warning regarding the C response, protein, and also other indicators, so we can see a development trend of the symptoms. And we also have the model to identify the patients with the higher possibility of fatality. So we also should be a good gatekeeper and also to give them the timely treatment, especially the convalescent plasma therapy, in order to prevent them to even severe condition. On top of that, we also use the leverage of the TCM and Western medicine, and also give the ventilation therapy. Based on the experience gained in the treatment of patients as well as the hospital management, we also compile the handbook, which was well recognized and acknowledged by the National Health Commission and the Central Steering Team. And also right now, this handbook has rolled out to the whole country. Based on the feature of a long duration of hospitalization as well as the multi-underlying disease, we also work with the different doctors from different departments such as the respiratory medicine, infectious disease, the critical care medicine, the cardiology, cardiac surgery, and we conduct the multiple measures, including the convalescent plasma therapy and also the needed therapy to treat our patients. Hubei Daily, a Sino-French news city of Tongji Hospital, still on the front line in fighting COVID-19. We see the medical teams from other provinces are right now already back to their home base. So what's the following plan in Tongji Hospital? So because the withdrawal of the medical teams from other provinces, more pressure right now depend on the doctors in the Sino-French new city hospital of Tongji Hospital, and we also will see more patients hospitalized in Tongji Hospital or transferred to Tongji Hospital for further concentrated treatment. So we will focus more on the treatment and cure of the COVID-19 patients. And right now we have the majority of the patients in severe or critical condition with multiple underlying diseases, which is also quite difficult and challenging to treat them. So we gathered the top team of experts from the multidiscipline departments to guarantee the quality of treatment. We will treat the patients of COVID-19 at any costs to pump life into the patients, and we'll for sure to do our best to treat them. Right now, the COVID-19 outbreak already become an international pandemic, and General Secretary Xi Jinping also urged a joint effort in fighting COVID-19. Would you please share more about your message in this regard? Thank you for your question. Regarding the COVID-19 outbreak, this is a severe challenge to us, and which also is a fast spreading, and also the challenge and threaten people's life. The WHO already identified the COVID-19 as the global pandemic. For Chinese side, we have some of the effective measures in treating the patients, and in response to General Secretary Xi Jinping's call, Union Hospital actually already conducted 18 medical conference with doctors from United States, United Kingdom, Italy, Netherlands, and the doctors from the African countries. And we also have 32 meetings in the pipeline. And we had a good cooperation with the hospital from Germany. They gave us a great support at the beginning of the outbreak of the pandemic in Wuhan. And I believe that right now this is a time for us to pay back. So we conducted the experience sharing with the hospital from Germany, and regarding the treatment of patients to the management of asymptomatic patients, we conducted 5 times of sharing. The doctors from the Department of Critical Care Medicine, the cardiac surgery, as well as the anesthesiology, conduct a meeting with our partners in other countries and also share with them the experience of makeshift hospitals and the Middle East hospital, European countries, and the countries from the Belt and Road Initiative. In total, 24 countries. We conduct a online meeting and also a live streaming with 15,000 viewers online. Virus respects no borders. The only way out is that we work hand in hand in curbing this virus. One last question. A question regarding the asymptomatic patients. Thank you for your question. Talk about asymptomatic patients, which means they show no symptoms such as fever or dry cough or chest displays, but their PCR result actually is positive to the virus. So after 14 days incubation period of medical observation, the patients felt okay and with no symptoms showed. And second, we talk about these group of patients actually was positive to the virus, but with no symptoms of a clinical manifestation. Based on the information issued by Hubei CDC, and we screening the people back to work, 0.08% of people show positive to the virus. The new asymptomatic patients till now, only one case developed to the confirmed case. Right now is quarantined in designated hospital, showing mild symptom, and that case actually was announced to the public on April 3rd. For the contact tracing, right now around 1,291. Right now we didn't find any secondary infection among the close contacts, which means that the transmissibility of asymptomatic patients actually is quite weak. Right now, the identified asymptomatic patients were all in quarantine. So we should protect ourselves well, wear masks, keeping your hand hygiene, doing ventilation, keeping social distance in 1 to 2 meters, and eating lunch separately. We will be safe. Thank you all the speakers and journalists. That does for today's press conference. Thank you.